Good afternoon, everybody. My name is Michelle Lane. I am lucky enough to be the Senior Director for Community Health and Wellness here at NKC Health. And I am so excited about the speaker that we have today. This gal is just an absolute treasure. Her name is Stephanie Moore. She is a Rockhurst University grad, also my alma mater. She graduated in 2017 with a doctorate of physical therapy and a master's degree also in management. She started in 2017 as well, and she started in the acute care setting and she moved into cancer rehab in 2018. Has really found this to be a passion for her. She received her board certification in oncology physical therapy in 2023 and became one of only two therapists in the whole entire state that hold that certification. She now works as the lead in our clinic, and I am so grateful that she's going to share her expertise with us today. Take it away, Stephanie.
Thank you, Michelle. Welcome, everybody, to today's talk. We're going to talk about managing cancer-related fatigue, and there'll be time for questions at the end. So you can drop those in the chat as we go along. So this is what we're going to be talking about today. We're going to talk a little bit about an overview of what is cancer-related fatigue and what can cause it. Then we're going to talk about things you can do to help manage it on your own. And we'll talk some about how physical therapy specifically can help you if you need a little bit of an extra boost there. So first off, what is cancer-related fatigue? This is actually somewhat of a vague definition, but the American Cancer Society defines it as a physical, emotional, and mental feeling of tiredness or exhaustion that does not improve with sleep or rest. The way that my patients describe it to me is a deep, deep tiredness. They'll say, I've never been this tired before. I'm so exhausted. I just wake up and I am just as tired as it was before I went to bed. I nap all day and it's exactly the same. It's different that that regular tiredness that some of us experience, it is definitely different. And I do feel like having this as a definition can be very helpful because I have some patients who are like, I'm tired and I don't really understand why, or my family doesn't understand why I'm so tired, especially my survivors who have completed treatment. They're like, I thought I would feel better now, and I'm just still so tired. It is definitely more than that. And it can be emotional or it can be mental fatigue as well, brain fog, and all of those sorts of things. So it's beyond that. If you're feeling like, oh, wow, I thought maybe it was only me that had this, other people are also feeling tired. Absolutely. Depending on what study you look at, cancer-related fatigue impacts 70 to 90% of all survivors, and that's across all cancer types. It almost doesn't matter which kind of cancer and which kind of treatments you have. Most patients will experience fatigue, unfortunately. And a lot of studies that have looked at fatigue show that along with pain, patients report that fatigue has one of the greatest impacts on their quality of life. You hurt really bad, you're very, very tired. Sometimes that can almost negate the other symptoms that you have. This impacts my life. I can't get out of bed. I can't go to that event. I can't hang out with my friends. I can't cook dinner at the end of the day the way I want to. It really impacts how you are able to interact with the world. So it is not just you. Many people have it, okay? And the reason that it impacts so many survivors is because it really, like I was saying, doesn't impact just one type of cancer or one type of treatment. It can happen from chemotherapy, it can happen from radiation, it can happen from surgery. Pain impacts our fatigue levels, anxiety, changes in your sleep. There's so many things that impact cancer-related fatigue. It really ends up impacting most survivors. So let's talk just a little bit about why it happens. So I, as someone who is not an oncologist, do not have all the answers here, but the medical community also does not necessarily have all the answers here. They don't really know why so many cancer patients experience cancer-related fatigue. We just know that it is unique to cancer survivors. So there's a few prevailing theories. One of the big ones has to do with your metabolic input and output. So as we are all sitting here hanging out, we're all burning a certain amount of energy. Some of us more than others, but we're all resting. I'm burning a little extra because I'm nervous, but we're burning some energy right now. When you are undergoing cancer treatment, how much energy your body needs has increased. We're doing stuff to it. You're getting medications that are causing cell death. You're getting radiation, which is causing cell death. You had a surgery, which caused cell death. You have things happen to your body that now your body is dealing with. It's got to take all of that cell death, get it out of your body, and then work on rebuilding healthy cells and tissue. That is an increase in your metabolic need. So even though we're just sitting and hanging, if you have recently experienced any of those, your body is burning more energy than somebody else at rest. That means when you then go to do an activity where we need even more energy, you on the inside is like, oh my gosh, I just ran a marathon. That was so much work compared to everybody else. So we need more energy and we might not have more energy. And then you feel that deep fatigue. And that's also what makes it different than the tiredness. There's some other reasons fatigue can happen. One is for key changes in your lab values. So if your team has said you are anemic, so your hemoglobin, your red blood cells have been depleted because of your treatment or because of your cancer itself, though that can also cause fatigue. It's a very similar type of fatigue. They all go together. If you're having poor sleep, that can impact your fatigue. And if you're like, girl, we just talked about how fatigue is not tiredness, you're right. However, if you're also not sleeping well, then your tiredness and your fatigue are going to impact each other and they're just going to go up and out of control, okay? Also, some medications, that is their own side effects specifically. And then for patients that are having hormonal changes, whether that's related to their treatment or not, that can increase your cancer fatigue as well. That one has to do with that metabolic level again. So that's why it happens in general. So if you're like, I definitely have that, how can I talk about this with my team? Your team is probably already asking you about your fatigue. I would hope so. But at most appointments with your team, radiation team, your medical oncology team, probably your surgeons as well, they're probably asking you, rate your fatigue for me on a scale of 1 to 10. Or are you having fatigue today? And you're probably answering it, and I'm sure you're answering it as accurately as you can. But I'm going to talk you through just a little bit the scale so that you can maybe help put yourself in the best range on there. So the way I describe this to patients is 10 out of 10 fatigue is the least energy. I have no energy. I'm taking a nap. I'm out. I'm done. That's it. We're done with the whole day. 10 out of 10 fatigue. 0 out of 10 fatigue is I have all the energy. I'm full of energy. I can take on my whole day right now. And there's your scale. Then you can work on telling your team, I'm a 5 out of 10 today. I'm getting to a 10 out of 10. I'm having to spend time in bed. Or as I'm done with treatment, maybe I'm more at a 1 or a 2. Along with that, your team is writing that down. They're putting that in your electronic medical record somewhere, and they're listening to you. I would hope so. I'm sure they are. They're all our team, especially here at our hospital. Our oncology team is fantastic. But if you're feeling like, well, I feel like I'm telling them that, and I feel like I'm doing it accurately for myself, but I haven't gotten any resources yet, it's okay to ask them about that. Your team is so focused on improving your life, getting you through treatment, getting you beyond treatment, that sometimes those things can fall by the wayside, or they might not realize how much it's impacting your life, okay? Which is totally fine. So it's okay to say to them, hey, my fatigue's been hanging out at a 6 or 7. I'm feeling a little tired, but it's really impacting my day. I can't go walk all the way to my grandson's soccer practice. I can't get my kids to school. I can't cook dinner at the end of the day, whatever it is. Let them know that. And then if they don't immediately offer resources, ask for a referral to help. That's no big deal. They will do that for you. And we have lots of resources. So with that, what kind of referral should I be looking for? We have a few different referrals. We're going to talk about the ask for help first, and then we'll come back to self-management. So people who can help you, it a little bit depends on what you think is currently causing your fatigue, but your team can help you with that for sure. We have our wonderful dietitian team. So if your lab values have been a little off, or you feel like you're not getting the fuel that you need, our dietitian team can totally help you with that. If you feel like it's more of like a mental fatigue, you've got brain fog, that chemo brain, our speech therapy team can totally help you with that. Speech therapy sometimes ends up as a little bit of a misnomer. You're like, I can talk correctly or I can eat correctly. They also do brain stuff. They do this whole section speech therapy, they got you. If it's feeling more physical, then our physical therapy and our occupational therapy team can help you. With that emotional and mental side of fatigue, certainly if you're feeling like you need further mental health help, our team can also work on getting you counseling, getting you into a support group, getting you that extra boost to help you along the way. And then what we're going to talk about are some things that you can do on your own to also help you in these areas. Our big self-management strategies, which we're going to talk through one by one, is exercise, nutrition, sleep, and energy conservation. We are not going to talk in depth about nutrition because we have wonderful dietitians who do that so well. They are way better than that than I am and more qualified. So for the nutrition friends, working with somebody to help you in that, or at least working to make sure you're getting the calories that you need, would be the base recommendation there. So let's talk about some energy conservation tips first. My big one is to plan your day. This is going to work best if you were somebody who's used like planning tools in the past. If you've never been a planner before, this task can feel very, very daunting. But a good way to start is to start by writing down what you have to do and what you want to do for the day or the week or the month, whatever feels doable for you. And then you're going to prioritize it. What I often see happen with my patients is they get going on tasks and they're like, I want to clean the whole house today because I feel good. I'm like, week and a half post chemo, today's a good day. I'm going to clean the whole entire house. And then they power through that until they run into a wall and then they're in bed for a day or two, which is hard to manage. We don't like that. It doesn't feel good on the inside. What I would encourage you to do instead is work on making that list. What do I have to get done today? The things that are going to make this household run, make this family run, make this body run, whatever it is. What do I have to get done today? Write it down on the list. And then plan it out. I feel like this week I have to get the dishes done. I have to get at least one load of laundry done. And I have to go out to have dinner with my mom this week. Those are my 3 really, really big tasks. These can't happen all on the same day. I don't have the energy for that. They have to get done this week, but I need to not plan all 3 of them to happen on Wednesday because it's not going to happen. I'm going to be in bed the next day. So instead, what day did I do laundry last week? It was Tuesday, so I probably need to do that earlier in the week. Mom's only free on Thursday. That's the day that has to happen. And then my other big task can fall on a different day, and I can prioritize my week. It's very helpful to see this visually because you're probably doing way more things than you realize, and planning it out is going to help you prioritize and not use all of your energy on those tasks. I would also encourage you to plan rest breaks and naps into it. Like sometimes people think I'm going to be anti-nap because you can't rest out of fatigue, but naps are so helpful. They need to not be crazy naps. If you're able to nap, set a timer for like 30 minutes or less so you come out of your nap and don't disrupt your sleep, go for it. But don't be afraid of the nap. Let the nap happen. It's okay. And then plan those rest breaks and those naps into the day. I'm going to do task A and task B, and I'm going to take a nap. And then I'm going to do task C and task D, and then I'm going to take a rest break. It's totally fine. Plan it in so that it happens, because what might happen is your body is feeling okay, you keep going, and then we hit the wall. We want to try not to hit the wall. So plan it out. Give yourself that grace, okay? If you're somebody who's never planned before and you're like, this sounds like the worst thing, you can do retroactive planning. Get to the end of your day, write down all the tasks you did so you can kind of audit your day a little bit, and that will help you with planning the next time, okay? And whatever works for you, write it by hand, use it digitally, say it out loud, whatever helps with you, but plan it out, okay? And then make those tasks as easy as possible. My favorite tip here is to sit down while you're doing the task. What a novel idea. We don't think about this. I don't know why, but I've always done the dishes in standing. Why would I sit down? I've always made dinner in standing. Why would I sit down? I've always dressed in sitting. Why would I sit down? Chairs exist though. It's totally fine. Ultimate life hack. Sit down while you do the task. You don't need to waste the energy standing to do a task when the task has to get done. So give yourself the grace. Sit down, pull up a chair. It's going to be good, okay? sit down for dressing, sit down for making dinner or making breakfast, sit down for hobbies, and sit down in the shower. This one I feel like sometimes patients don't want to do. I'm not totally sure why, but save your energy for the boring task. You have to take the shower, right? It's got to happen. Save your energy there to do something more fun. You're probably taking the shower so you can do something more fun or something less fun, like go to your doctor's appointment, but it's got to happen. Sit down, save your energy in the shower, and then use that energy you saved to go do something more fun with your energy. Along with making tasks easy, move the things that you use most often to an easily accessible location to the best you can. Sometimes the way the house is set up is the way the house is set up. But let's say you're somebody who always uses a bowl for your food and you rarely use a plates. If your bowl is up on the second shelf, put it on the first shelf so that you save that energy reaching overhead and lifting something heavy when it could be eye level, it could be chest level. Make it easier for yourself. If you've got the counter space, put it on the counter so that you don't have to waste that energy for a task that has to happen. Put it where you're going to use it, okay? And then break your tasks into as small steps as you can. This one happens to my spouse quite a bit. He's the kind of person who's like, I'm going to clean the whole kitchen. And he does the whole thing. And I'm like, I'm going to set a 10-minute timer and clean what I can, and then I'm going to take a break. It doesn't bother me that the task didn't get finished because after my little break, I can finish it. If you're the kind of person who has to finish a task before you do anything else, totally valid. I feel you. But you might consider making the task smaller so that you can then take a break. If your task of cleaning the kitchen actually secretly involves 6 small tasks, do 2 small tasks, take a break. Do 2 small tasks, take a break, okay? Break your big tasks up, put it in your plan so you can see it, and then give yourself those rest breaks along the day or spread them out throughout the day if you can. You'd be surprised how many things you can space out throughout your day and it still gets done at the end. If you are able, getting something or having someone to help you make a task easier is our last little energy conservation life hack here, okay? This might not be accessible to everyone, and that is understandable. For some of you, your insurance might be able to purchase you pieces of equipment. That would be a conversation to have with your team, with your insurance, with your social worker perhaps. But things that can make tasks easier for you are things like shower chairs. Remember, sitting in the shower, save that energy for something more fun. Grab bars to help you get on and off of things, and walking devices. If you feel a little teeny tiny bit unsteady, or if you get winded when you're doing walking activities, having something to support you, a cane, a walker, walking poles, if you're younger and you're like, I don't want to use a walker yet, understandable. Something to support your body so that necessary task of walking or moving is now assisted so that you are spending less energy and you can use it for something more fun later. If you are in a situation where you are blessed with people around you who can assist you, don't be afraid of asking them to help you with this task. If they're somebody who loves and cares about you, hopefully they're going to be able to do it for you, okay? It's all right to ask for help when you do not have the energy. This can be hard. We don't see energy loss the same way we see some other side effects of cancer. So I know for some people it's difficult to ask because they're worried about the person they're asking not understanding all the way. And that is a totally valid feeling to have. But if you need help, you need help. Okay, ask them if they can swap the laundry for you. Ask them if they can bring over dinner, or can you come over and chop vegetables with me while I make dinner? Don't be afraid to ask for help. All right. The other thing we could do along with energy conservation is use exercise to improve our energy level. And if you're like, this is just because you're a physical therapist and you just love exercise, that's your job. Hang on. So turns out studies suggest one of the best ways to help cancer-related fatigue is aerobic exercise, which is cardio exercise, not to a crazy amount. I don't want you to go out and run a marathon if you've never run a marathon before. If you hate running, totally fine. You don't have to run. That's okay. Doing activities where your heart and your lungs are working more impacts that metabolic deficit that we talked about way at the beginning. And it improves that system so that your energy mismatch is not so extreme. Along with that, there are some studies that suggest things like strength training can impact your fatigue some. Most studies still show that cardiovascular exercise along with strength training are better than strength training by themselves. But regardless, at the very least, cardio, and if you got it, a little bit of strength training is going to help you on that journey. We will talk at the end here very briefly about reasons that you might need additional assistance with exercise or some safety considerations with exercise, but we will come back to that. So the American College of Sports Medicine recommends for cancer survivors cardio, they've got cardio and strength training recommendations, okay? So for cardiovascular exercise, they recommend working towards 3 times a week where you do 30-minute sessions of light to moderate intensity exercise. This isn't hard exercise. It's not crazy. It's not running. It is things like walking or biking, hiking, dancing, swimming, or cardio drumming. I've had a lot of patients recently do cardio drumming. It sounds so fun. I want to go try it somewhere, except I feel like I'm going to run into a patient, but it sounds great. It sounds so fun. Anyway, you don't have to run. If you like running and that was something you were doing before your diagnosis, go for it, but keep your intensity low. We don't need to overtax that system that's already taxed. If you were not an exerciser prior to treatment, that's totally fine. It's never too late to start. Start very small, working your way up, even if it's just 3 or 4 minutes. I have plenty of patients where we start our very first week. I want you to get up twice a day, put a timer on, walk 3 minutes in your house, and then sit down. And that's it. That's totally fine. It doesn't have to be that 30 minutes right off the bat. If you were an exerciser before treatment, but you haven't yet had the opportunity to exercise during treatment, I would also encourage you to back it way down first, see how your body feels, and then increase on the other side. Similarly with strength training, starting very small. You don't even have to use weights at first. You can just move whatever joint isn't hurting, move it 8 to 12 times, give yourself a rest break, move it 8 to 12 times again. Moving the major joints in a position that doesn't hurt, okay? Not very hard. You can totally do that. If you have little weights and moving just your body weight feels a little too easy, pop a little weight on there. It does not have to be crazy, okay? The American College of Sports Medicine recommends for survivors working towards 2 times a week sessions where you do 8 to 12 repetitions and 2 to 3 sets, okay? And remember, if it has been a little bit since you have done some exercise, you might feel a little bit of muscle soreness afterwards, which is a normal response. It does not mean anything is wrong. And if anything, you should anticipate that a little bit so that it doesn't feel too stressful when the next day you wake up and you're like, ooh, I moved my arms up and down a whole lot yesterday and the top of my back hurts. It is the muscles, and that's okay. The more you do it, the less sore you will become over time. There is a general recommendation for stretching and flexibility from the American College of Sports Medicine. It's just to hold positions that feel good for your muscles. So just like with our other ones, no need to get crazy with it. Some stretching will help with your muscle soreness afterwards, but your priority is really the cardio and then strength training, adding in stretching and flexibility as you feel comfortable and ready. This is the infographic from the American College of Sports Medicine that has their recommendations. This is from some really, really cool studies that they've done. They've done this twice now. They did it 20 years ago, 25 years ago. And then they did an update 10 years later, which it has now been almost 5 years for, where they got together experts in a lot of different categories and they looked through all of the data that has been published over that length of time to make these recommendations. So to put you into the chart here a little bit. So the outcome is what they were looking for. So evidence for improving cancer fatigue, quality of life, physical function, that's that first column. Second would be if you only did aerobic exercise, that aerobic is cardio exercise, how that would look for it. If you're going to do just resistance or strength training, this is the research and evidence for that in the third column. And then that fourth column is a combination of aerobic and resistance exercise. And you can see for some of these, like anxiety and depression in cancer survivors, they found that resistance training only or strength training only didn't actually have good evidence for it, which is why we recommend at the very least cardio, and then cardio and resistance exercises together. Okay, so if you're like, oh my gosh, I love that, I'm hyped, I want to start exercising right now, what do I do? Take it easy, okay? So lots of resources to help you. One thing would be to just start walking if you are physically able to walk. That's the free, the cheap, the easiest exercise to kind of handle because you can walk around the house. It's about to be prime walking time outside in the state of Missouri where it's not too hot, it's not too muggy, there's not snow on the ground yet. It's about to be perfect walking weather if you are someone who is safe to walk outside. So, could be the perfect time to start a walking group with your friends, with your families, with your neighbors, somebody around you. You can totally walk by yourself too. Exercise is more fun together, but whatever floats your boat. If you're looking for a little bit more community or independence, really either one, you can also join the NKC Health Fitness Center, and they've got group-based classes that you can look into. We also have water fitness, which if you are someone who weight-bearing exercise, so standing exercises, are uncomfortable for your joints, water aerobics is where it's at, okay? I will warn you, if you have very high levels of fatigue, you cannot tell quite how much energy you're using in the water. So you do need to be a little bit careful if that's what's going to be your very first interaction with exercise, okay? If you are not close to NKC Health, if you're a little further out, you can also look into your local community centers to see what discounts they might have based off of your insurance, based off of your diagnosis, or based off of where you live. The other cheap and free option would be to look for YouTube videos. I would always recommend typing in beginner at first. So chair yoga for beginners, stretching for beginners, seated cardio, similar to the cardiac drumming situation. We don't have to get really crazy to get in our cardio. We just need to move our body. So if you don't feel like you need physical therapy level assistance, but you're like, I want more guidance than maybe those, you can also find a personal trainer who works specifically with survivors. And at NKC Health, we have some wonderful personal trainers in the fitness center who are totally ready to help you. All right, changing from exercise, we're going to talk just a little bit about healthy sleep habits. So again, cancer-related fatigue is not going to improve with rest. However, having healthy sleep patterns and behaviors is going to help with your overall fatigue level, even if it won't get rid of it though, okay? One good tip is to actually have a fixed wake up time. I feel like a lot of times when we're trying to improve our sleep habits, we think about going to bed at a specific time. But then if you're the kind of person who ends up laying in bed awake for hours, we start pushing that wake up time out because you're like, I still have to get 6 hours in or 8 hours in. I need to now get up later and later and later. If you start getting yourself in the habit of having a consistent wake up time, it will eventually, with other things, help adjust your sleep back to the time it needs to be. So it doesn't have to be super early. Those little people on the internet who are like, wake up at 4 a.m., go jump in the ocean. We don't have an ocean close enough, but you don't have to get up at 4 a.m. if you don't want to. If that's what you like, get up at 4 a.m., go for it. But if you don't want to get up at 4 a.m., you do not have to get up at 4 a.m. But set yourself a consistent wake up time to help your body get back in that habit of, okay, I'm waking up now. I need to get enough sleep. This is when I need to go to bed. Along with that, consider setting a bedtime routine. It doesn't have to be a consistent time, but things that you would do each night before you get in bed to start reminding your body that it's going to be time to sleep soon, okay? With your bedtime routine, you can work on setting the mood, dim the lights, unplug from your electronics, lower your thermostat if that's something that's fiscally responsible for you. One of my favorite things, on the iPhone at least, is that you can put your iPhone into sleep mode where you stop receiving notifications, which for me is the best. It does have, as like a very brief aside, it does have like an emergency setting, like I have it set so like my husband can still call me and my mom can still call me and like they can still call me and access me if there's an emergency. but it turns off all my like social media notifications and it turns off my silly little game notifications so that if I'm having a hard time sleeping, I don't also see my phone going off over there where my brain is like, oh, we could be doing something more fun than sleeping. You can turn that off. I'm sure there's an option out there for Android and Google users as well. It will also help you if during the day you get more physically active, all right? Burning the other sources of energy a little bit during the day is going to help you feel a little bit more sleepy at night. It's going to be easier to rest your body if you've moved it a little bit during the day. If it is safe for you, getting some sunshine in, whether you're fully covered because your chemotherapy has impacted your skin integrity, and you've got your sunscreen and you got your long sleeves and you got your hat, totally fine. You can still be in the sunshine without the sunshine being on you, all right? It's mostly seeing it and being around it will help with that. If you're able to get in some skin exposure with the okay from your oncologist, that would be good for your body as well. Other things you can try before bed would be to help shut the brain off a little bit. Things like meditation, prayer if you're religious, or journaling activities can help kind of pop those thoughts somewhere else. I personally am not a journaler. I don't like to write things down, but sometimes when I'm having nights where I can't sleep because I've got too many things going on in my brain, I find it helpful to like internally journal the thoughts. So whatever those thoughts are that are making me stress, put them in some sort of list and then I can reorganize them that way. It would probably be easier to write it down. I just don't like to. But if I've been thinking all night, oh no, I have to get my slides to Michelle for my presentation, and I didn't start the dishwasher, and I need to finish up that note from a patient today. I can put it into a little mental list and then move them appropriately, right? I shouldn't email Michelle in the middle of the night. I can check that off the list. She wouldn't like that. Maybe I actually can get up and go start the dishwasher, and that maybe will help me with that little piece of the brain that's making me angry. And I can't write my notes right now because I don't have my work laptop. So those two have to get off the list. The other one, I guess I could go do that. Let me take care of that, come back into bed. So now my brain is a little quieter because I've adjusted my list. That's helpful for me. You do what's helpful for you. Remember with your sleep tips, if you're still in active treatment and you receive a steroid with your chemotherapy infusion, then sleep on those days is going to be more disruptive. You got a literal steroid. The body's going to be hyped and it's going to be harder to sleep. And that's okay. Working on your sleep schedule and working on your routine on those days where we are not going to be exposed to steroids is going to help the overall sleep situation settle down, okay? With the sleep tips, you also don't need to do this whole entire list. Pick one item off of here that you're like, I feel like I could do that one, and try it for a little bit and see how it goes. Making a big radical change right now while you're going through something stressful is going to be hard. So pick one thing off the list, be like, I can do that. I can dim my lights a little bit sooner before I get into bed. I'm going to try that one for a week. Awesome, go for it. Maybe you're like, I want to put my phone in sleep mode and figure out how to do that. And I'm going to do that for a week and see how that impacts my sleep. Perfect. You don't have to do them all. It's all right. Okay, I think this is our last thing here. This is our special considerations for exercise. So I'm just going to read the list. We got bone mets, significant shortness of breath with activity, balance problems or feeling unsteady with movements, low platelet counts, and heart disease. This is heart disease prior to the start of your treatment, but if your treatment has caused heart disease, you count on the list, all right? If you have any of these, you need to come see me before we get in some good exercise, or one of our oncology physical therapists. We have 3 at this hospital. We're all totally ready to help you. There are some other hospitals in the area that have some oncology PTs as well. Ours is the most robust version at the moment in the area. So if you have something like bone mets, I don't really want you going to the gym and lifting some heavy weights tomorrow, okay? Come talk with me first, and let's find a good exercise plan together. If you are getting very short of air with all activities, first make sure your team knows, and then come see me before you start a cardio program, all right? If you're unsteady, I don't want to see you on acute care because we broke something. No, come see me. Let's get your balance under control first, and then manage your fatigue on the other side. Low platelets, again, working with your team, coming to see us so we can make that exercise safe and accessible to you. And then heart disease, We even have at this hospital, we have something called our CORE program, which is our cardio oncology rehabilitation. And we have that set up directly with Dr. Malay, where we do a specific set of things to help you manage your fatigue and work on your strength while being monitored by our wonderful cardio oncology team. So if you fall into any of these categories, come find me. We got you, okay? You can, in this state, see a physical therapist without a referral from your physician. However, if you would rather chat with your oncology team first and get a referral to us, that is totally fine too. Even if you do come see us without a referral, we're still going to communicate with your physician team. So either way is all right with us. If you want to chat with them and then see us, totally fine. If you want to just call up therapy and see us, also totally fine. Okay. Either way, we got you. All right. If this made you so excited, you're going to come see me. I'm excited. We're all excited. Here are some things, some books that you might look into to get a little bit more information. I did check all of these except for Cancer Fitness, the second one on the screen. All of the other ones are available at the Mid-Continent Public Library in both physical media, digital media, and audio. So you have access to those for relatively cheap if you're someone close by and has a Mid-Continent Public Library card. Cancer Fitness is a little bit of an older book. You might be able to see on there, it has a foreword by Lance Armstrong, which, they might not do nowadays, which is okay. That one's not available at the library, but you can get it online for pretty cheap. So all of these books are lovely. 3 out of 4 of them are written by cancer survivors, which is really, really cool. So if you need a little bit more information, there's that for you. The next slide is just references. If you're like, I really, really, really want to deep read some long academic articles, here you go. Okay. All right. That's all. Any questions? I think we might have to wait for Michelle to get back on. Let me see.
I'm back on. I'm so sorry.
That's okay.
I was checking the chat and I was checking the questions. Just a lot of comments about how wonderful and warm and inviting you are. And just a lot of like, oh my gosh, I love this gal's energy. And so thank you so much for being yourself, Stephanie. I love your approach to this. It is so whole person and just meeting people where they are. We are so lucky to have you on our team. And thanks for sharing your expertise today. You guys have a good day. Thanks for joining.